Robin wants to know how it reduces pain.
A few theories. With one of them is what's called substance P washout. So substance P with chronic tendinopathies is now sort of known thing. So we came from tendons. Tendonitis is inflammation.
Yeah.
Tendinopathy is not inflammation. Now we've realised that's not entirely true. It's just neurogenic inflammation. So you're getting lots of substance P, other sort of inflammatory peptides sitting in the tissue. You push a pressure wave through it. You're just clearing it out a little bit, massaging the tendon itself. I think that's a fairly well trodden theory. It does seem to have, focus shockwave seems to have an anti-inflammatory effect. So that works at a biochemical level. Radial doesn't have those sorts of responses. Radial's more of a blunt tool, just clear out the tissues. Yeah. There's no doubt it has a pain gate effect. Of course it does. You're repetitively loading the tendon, and vibration we know is pain gate. And of course there is, this is a flashy looking machine. I greatly believe in it because it's shiny. There's all of that involved.
Combine it with the pictures you put on the screen with your sonography.
Absolutely right. So, but that is in everything we do. The non-specifics of care, how we treat and create rapport with patients. I don't hide away from that. And
so obviously part of this is that you can show them your sonographs before.
Yeah.
And then afterwards, you can show them how they've got better.
Yeah, good. No, we try and stay away from that one. So with chronic tendinopathies, they don't change that much after they get better. So even with
the picture doesn't, the pain picture
doesn't. No, that's unfortunately the case. So there's always some, hyperemia, we call it, sort of intravascular penetration into chronic tendinopathies, and you sort of scan them. But I've done that a year later when they have a flare up, and it's just exactly the same image. It doesn't really change much. Plantar fasciitis is known for its thickening and it loses some of its white texture. That doesn't change much either. But the patient will be, I'm fine. I've no problem at all. So my imaging, the sonography is a part of the puzzle. It's a fairly good bit of the puzzle, to be fair. Yeah. But sometimes you can be amazed and you see all sorts of horrible things, like we do with MRIs.
Yeah. Would it be fair to say that, the ultrasound will show you where there's a problem?
Yes.
But it doesn't necessarily mean it's going to change when you treat that problem.
Yes.
The pictures.
Yeah, exactly right. Yeah. Ultrasound's probably most useful for ruling stuff out more than ruling in.
Okay.
So it's not that, it's not that, it's not that. So just by the algorithm of things and my clinical examination, it probably is just this issue. Most of the time I use it to reassure patients, really.